Hello, 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 and welcome back to the topic where we highlight Houston community colleges, our students, our programs, and our reach into the community. I'm Dr. Darin Baskin. I am the Executive Director of the Weekend and Honors College. And we all know what this should be talking about this time of the year. It's cold and flu season. And I'll just say, just right up front, I think I've had the flu once already. So I'm happy to be talking to our experts about the cold and flu season. And not only are we dealing with the flu season, we're also dealing with COVID and RSV. Today, we'll talk about some simple ways you can mitigate your risk for respiratory infections. First, we're joined by one of my favorite guys here at the college, Teddy Tovar, who is the program director for HCC's Respiratory Therapy program. Hey, Teddy.
Good afternoon, Dr. Baskin, and thank you for those kind words. Greatly appreciate that. And you're one of my favorite guys on the college, too. We've grown to know each other really well, and it's a pleasure knowing you, and thank you for inviting us to the program.
Oh, yeah, happy to have this discussion with you, because as we know, we've been told over and over and over again that these seasons are getting worse and worse, and you probably need to make sure that you're getting those vaccinations fairly every year now, because it seems like they're just getting worse and worse every year. So let's talk a little bit about those vaccinations and those immunizations, and let's look at it from the offensive approach.
Yes, you're absolutely correct. Unfortunately, we are in a time right now. The season is that we have three things out there that you just mentioned them. The flu, unfortunately, COVID-19 still lingering around, and RSV. Unfortunately, they all have similar symptoms, so it's difficult to distinguish one from the other. And that's what makes it even more difficult for us healthcare providers, is trying to distinguish and troubleshoot what it is. When we look at these three types of issues, we are concerned from various populations. First, the very young babies, infants, toddlers, and then we also look at our elderly patients, grandparents, those folks that are, I would like to say, 65, 70 and above. And then we also have that population that have a low or inferior immune system. We got to make sure that these populations are well taken care of. And like you just mentioned, from an offensive side, that's what we like to look at it is, what can we do from an offensive approach to try to protect ourselves? And that's going to be those immunizations that you just mentioned. Everybody's talking about the COVID-19 immunization. When it first came out, it was a big thing. People were worried about it, but now it has become part of our immunization armory, if you will, just like we have a flu shot. And some folks think, well, I already took the flu shot. It's completely different. So it's important that our population or our folks know that it is different. So is the RSV vaccine. So it's important that everyone does have their vaccinations to try to fight. Just because you're vaccinated with the flu shot does not mean that you will not get the flu, because there are various strains of flu. So right. You are vaccinated, but if you were to get a different type of or different strand of flu, the symptoms are going to be less. You won't be hit as hard. And the same thing with COVID-19. Now, when COVID-19 first came out, there was an immunization for that. And now there's various strands. The unfortunate thing about the flu and COVID-19 is, as it passes from one person to another, it basically mutates and becomes bigger, stronger, if you will. And so it takes on a different form. And so that is why, even though you're vaccinated, you're still you may get ill. And then there's folks that, they end up with the flu or they end up with COVID-19 and have no symptoms whatsoever.
And you brought up some great points, and I want to make sure that we look at some of these things individually, because the point about the vaccinations is very important, because people were very leery of the vaccinations when they first came out, because they came out so quickly, and a lot of individuals was scared about of course, the side effects and the outcomes of taking those. So I'm glad you brought that point up, and I'm glad you cleared it up and say this is just another vaccination that's in our arsenal. So that makes that sounded really good. And then you mentioned the high risk populations. We definitely have to ensure for those high risk populations that they are protected. And so I think if we look at it along the lines of give us a short overview of the differences between the flu, COVID-19, and RSV.
Well, with RSV, let's start there. It is very easy to detect. Well, not easy to detect, but the high-risk population for RSV are going to be the young, okay? Babies, newborns, premature babies. That's going to be more of the RSV, whereas the COVID-19 issues and the flu issues are going to be within the mid to adult age patient or population. Differences between the two, like I mentioned earlier, the symptoms for COVID-19 and the flu easily overlap, The difference is here is that honestly, to detect one from the other, it's going to be simply to take a COVID-19 test. And even then, you may get what we call a false negative, which means that you start feeling bad, you do the swab, you take your test, and it reads negative. You wait 2 days later, and then it turns out to be positive. So you have to be diligent about testing, frequently should you be feeling bad. Again, the difference here is that the symptoms overlap so much that it is difficult to just say, oh, I have the flu, or vice versa, I have the COVID-19. Again, the best thing to do is select a testing kit of your choice or go to a clinic and obviously test yourself. I know that a few months ago, the U.S. government was sending those tests out for free. Mm-hmm. And I was on the computer. I got my four tests because
I got mine too, Teddy.
Everything's better when it's free. So I was able to do that. And nowadays, I've also heard that a lot of insurance companies are willing to take on the pay for the COVID-19 test. I see a lot of advertisement, and I'm not supporting anybody. There's my little thing here. No, I'm not getting kickbacks. So I've seen the advertisement with CVS and Walgreens and some other pharmacies that they help you get the test kits via your insurance. So
right, and you hit the point I wanted you to make, which was to say that the symptoms overlap, so they seem similar. So it's the best approach to take is to just get the COVID-19 tests. And so I'm glad you broke it down like that. And so in the next, say, 45 seconds, we know that there's a lot of defensive approaches that we can take also to help with these respiratory infections. Can you give us some examples of some of those that we can do like in the next 45 seconds?
The easiest, quicker things to do, honestly, Dr. Baskin, is going to be wash your hands, wash your hands, wash your hands. Well, I think that in general population, people really don't take into consideration how many surfaces one touches, whether it be a door handle at the store, whether it be the door handle on your car. It could be the door handle to the living room in your house. If somebody in the family or a friend comes over, they're ill, they touch that doorknob, you just never know. Simple Lysol, Clorox, whatever brand you want to use, something that disinfects, wipe it down. Try to, especially if someone in the house is ill or someone has visited that may have been ill, it's a good idea to just wipe down.
I totally agree with that, Teddy.
Wipe down counters, high travel or
high touch areas. Yeah,
yes,
so perfect.
Yes.
Hey, look, me and Teddy are going to continue this conversation when we come back, but we'll be exploring HCC's respiratory therapy program.
At Houston Community College, we make your lessons matter. Open the door to real-world education, where passions become careers. Find out more at hccs.edu and let your success take flight.
For more than a year, we have kept you informed with more than 500 remote episodes. But now we're back, bigger and better with more news and more guests. Join us live every weekday at 10 a.m. on Facebook and YouTube, and on HCC TV at noon and 5 p.m. You can watch from anywhere. We go where you go.
Welcome back to the topic. We are continuing our discussion with Teddy Tovar, my friend, who is the program director for HCC's Respiratory Therapy program. So we just had a great segment about the offensive and defensive ways in which we can fight some of these respiratory infections that are out there. That is always a good way to start a segment. But now let's talk about how we can get and recruit more students into these respiratory programs that you're offering. Teddy.
Well, thank you again, Dr. Baskin, for having us on the show. Really appreciate this. The Respiratory Therapy program, in a nutshell, we are a 2-year program that when you finish, you will obtain your Associates of Applied Sciences in Respiratory Care. Okay, and then you get your credentials to become a practicing respiratory therapist by taking on national boards. And as I mentioned, it is a 2-year program. And because it is a 2-year program that you receive a degree with, there are some things that you have to do before coming into the program. And one important thing that I want to point out is that the respiratory program is only offered at the Coleman campus in the medical center. Okay, it's the John B. Coleman campus, and we're at 1900 Pressler in Houston, Texas, 77030. Okay, I get a lot of emails, phone calls asking if we offer this program anywhere else, and I have to tell them no, it's only offered here at the Coleman campus in the Med Center. And that's
I think Teddy, I think it's a good idea because you mentioned it, and I don't want us to slide past it. The admissions requirements. Let's talk about that because I know there's some prereq work that a student has to do between actually getting accepted into the program.
That is correct, Dr. Baskin. One of the things that we have is we are a selective program, and the selection is based on a point system. And what a point system allocated is you complete your prerequisite coursework, we review your application, and we look at your GPA, we look at your transcripts, see what kind of grades you made. This program is very heavy in math and science, so our prerequisite coursework is going to involve A&P 1 and 2 with lecture and lab, A&P 1, lecture and lab, and also college algebra. We also have our own course, which is the Introductory to Respiratory Therapy 1201, RSPT 1201. And we have that course out there to make sure that if you want to come into respiratory therapy, we want to make sure you have the knowledge of what is it that we do? What is it that a respiratory therapist does? A lot of folks want to get into something, and we want complete transparency. We want to make sure that you know what you're getting into. So those are the requirements. Along with the prerequisite coursework is going to be immunizations. And it's funny because the earlier segment is a segue into this. Again, you will need to have your flu shot. You will need to have your titers for MMRs, varicella, things of that nature, hepatitis B. That's one of the immunizations that usually hinders students from coming in is going to be the hepatitis B because it is a 3-shot series. So it's very important that when you guys start looking at coming in here or wanting to be admitted into the program, that you get your immunizations in order. One thing that we have provided on the college website for the respiratory therapy program is our program's admissions guide. And it is detailed step by step of what you need to do. Even if you're transferring here or you're a first-time HCC student, it takes you through the application process to be admitted into HCC prior to coming into the program.
Oh, that's amazing. And I'm so glad that you put a plug in for the HCC website because we have to get students onto their website to be able to navigate it, to find this information that will give them the answers to their questions when someone is not available. And so thank you for driving students to the website. Now, I want to run us back also to, you mentioned that the program length is 2 years. So because of the length of the program and the rigorous program itself, is this a cohort-based program? And when do you allow the cohorts to start?
Okay, that is correct. It is a 2-year program, which means that you start. We do 3 semesters. The whole year: fall, spring, summer, and you graduate. You start in the fall, graduate 2 years later in the summer. It is a continuous 2 years. The only break the student gets is in the faculty. It's going to be in between semester breaks, for example, Christmas between summer, and that is it. But it is a continuous circulated of the 2-year program. So it is 2 years, but when you're done with us, you're gonna have a great job, a great career. Like I tell my students, give me 2 years of life, I want to give you a lifetime career.
Oh, I love that. I love that. I love a good jingle. So
Yes.
that sounds good. And you also mentioned that part of the program requirements is for students to be immunized. Let me ask you this. I know because of the work that they're going to have to do, they're going to get jobs in hospitals.
That is correct.
Clinics. So you want to talk a little bit about that part of the requirement of being able to maybe pass the background check that goes along with working at a hospital?
Of course. So just as HCC, we have to follow what the hospitals mandate from our students and from the program. Part of that is going to be, like I mentioned earlier, the immunizations. All those have to be complete and in order, because at any given time, the hospital can do an audit to make sure that the students that are going into their hospitals are protected, not just to protect the student, but also to protect the patients. You're coming in to see patients that are ill. Depending on the hospital that you're going to go to, the severity or the acuity of the patient is going to be completely different from section to section. As far as we also have to maintain a good background, because we no criminal record. We look at background checks. We also do toxicology reports. Better yet, better known as drug screens. We've all, we don't want to know what you've been doing, but we will know come when we get the results. So we want to make sure that the folks that we're sending over to the hospitals are going to be coherent. You're dealing with patients' lives. You're dealing with real life patients. This is not simulation. So we want to make sure that our patients are safe and that our students are safe.
Yes, and I think you really summarized it, because we have to understand that we want to have the safest environment for the patients, but we also want to make sure that the employees of hospitals, our students that we're sending out there, they're also safe. And so I appreciate how thorough the department is when it goes to reaching out to students. So very much appreciated. So in these last 45 seconds of our conversation, Teddy, tell us something about the program that will encourage students to run to hccs.edu and start the registration process.
Well, not to toot our own horn, but we are the best program around. Okay, I know we have our counterparts, we have our educational partners, but I'm going to toot our own horn. We are very proud of this program. It is a team effort between myself and our faculty. We've been able to build deep roots in the medical center. So we have great clinical affiliates, great clinical partners. And to be quite honest with you, Dr. Baskin, a lot of our graduates actually have leadership roles in the hospitals. I'm talking about directors, supervisors, coordinators. So we're very proud and we build upon that. So we want to make sure that we feel strongly that we have an ethical responsibility to put out the best respiratory therapists we possibly can.
And, I will say this, so you will never have to say this again, toot away, okay? Toot, toot.
Thank you.
Very good. So, hey, Teddy, it has been a pleasure. When we return, we'll learn about the accomplishments of the HCC Respiratory Therapy program.
At Houston Community College, we make your lessons matter. Open the door to real-world education, where passions become careers. Find out more at hccs.edu and let your success take flight.
When I was your age, I was just like you, fascinated by stars. But now I get to search for life in the universe. And who knows, maybe life is looking for us too.
So we're like aliens to them?
Yeah. Does anyone want to be a scientist now?
I do.
Awesome. We need more girls in STEM.
Maybe we can find aliens.
Things could be stranger, but I don't know how. I'm going through changes, through all of the strangeness. I'm going through changes now.
So welcome back to the topic where we are here tooting our horns about the HCC Respiratory Therapy Program. I got that from Teddy in case you don't remember that. Now we're being joined by James Campbell, who is the Director of Clinical Education and one of our award-winning faculty here at Houston Community Colleges. He's going to work with us to understand the program and some of the notable accomplishments. Welcome to the show, James.
Thank you, Dr. Baskin. Thank you for having me. Appreciate it.
Oh, yeah, I'm happy to have you guys. So let's just jump right into these accomplishments because, I love to hear about what we do well because we do a lot of things well. So let's talk about this national board pass rate.
Oh, yes. I would say I'm very blessed to be part of this team, this wonderful organization. Now, for our graduates, upon finishing the program, they are qualified to take the National Registry exam that's given by the National Board of Respiratory Care. And great news, again, going with Mr. Tovar, that we believe that we are the best in the Houston area, and it's because our program has achieved a 95% or higher on first-time pass rates on the national board exams. Now, compared to the national average of only 72%. And then there were some years our program actually achieved 100% on pass rates.
James, I need you to repeat that just for the people that weren't paying attention the first time.
Right.
Are you telling me that our pass rate at Houston Community College is 95% and the national pass rate is how much?
72.
Oh, wow. Now that's a toot right there. I am amazed at the work you guys are doing over there. And so I guess then that causes us to be able to have those positive placement rates.
Correct. Okay, so our graduates of the program over the last 3 years, once again, has achieved over 95% job placement. That's over 95% the last 3 years. During the pandemic, the COVID-19 pandemic, our graduates actually had 100% placement rate. And some were earning from $100 up to $150. Now that was during the pandemic. Another example is the last graduating class. 80% of those students got employment as a respiratory care student even before they graduated. Currently, our senior students, a lot of them already have employment as respiratory care students at the various hospitals in the Houston area. So what's happening here is our graduates actually supplies the employment pipeline to meet the healthcare needs of our service area, but they also address the respiratory care shortage, and which was significantly identified during the pandemic. So the Bureau of Labor Statistics projects actually a 13% employment growth between 2022 to 2032. And so that's about 17,000 jobs that needs to be filled. Recently, U.S. News ranked respiratory therapists within the top 100 jobs for 2024. Right now in the U.S., the unemployment rate is at 3.7%. For respiratory, it's less than 1%. It's 0.6 unemployment rate for respiratory.
Wow.
Yes.
That is some amazing statistics. That just shows that the work that we're doing here at Houston Community College over there in that respiratory therapy program is nothing short of amazing. And so what about this 10-year accreditation?
Right. So we, again, it's a great team to be with. We've achieved this twice that I've been here. And so the 10-year accreditation, that's the highest accreditation that's given by our accreditation body, which is the Commission of Accreditation for Respiratory Care. So what happens here is the program has met and even exceeded those accreditation standards with no citations whatsoever. And that's how we're able to get 10 years accreditation. So it's actually, we have achieved this twice. So the total has been really 20 years.
Wow. So how many recommendations did you say, James? Zero recommendations.
Yes, 0 citations. Yes.
0 citations. Oh my God. That is amazing. That it just goes to show that when you have a good product and you do it right, you get those types of results. And part of that is the faculty that we have riding the ride with those students semester to semester. So thank you for the work that you do as a faculty member. It is amazing. So let me ask you this last question. We do a lot of partnerships. Talk to us a little bit about those clinical affiliations that we have and those patient care practices.
Okay, all right. But before I get into that, I forgot to mention our program for the last 10 years. We've also received the Distinguished RRT Credentialing Success Award.
Oh, wow.
Yes.
Again, I love that. And so with these clinical affiliation partners, give it to us in about 30 seconds.
Okay, so again, we're very grateful to be here at the world famous Texas Medical Center. We rotate to a lot of different hospitals throughout the Houston area, but our concentration is here in the TMC. So with collaboration with the various healthcare organizations, we provide the students a very rich experiential experience in the various clinical settings. So they're at the adult floors, ICU, pediatric floors, pediatric ICU, and even the babies, the premature babies for neonatal ICU. So this rich experience helps the student decide what area they want to focus when they finish the program, but also they're able to practice in different areas throughout their whole career. So it's not just a job, it's a career. So the ultimate goal of the program, not only is to pass the boards, but is to ensure our graduates are fully capable, ready for employment to provide the best respiratory care possible for our patients.
Oh, wow. And James, you did that in the amount of time. And thank you for sharing that. I want to personally thank Teddy Tovar and James Campbell for joining us today on the topic. Thank you guys for joining us. For more information on this topic, visit hccs.edu/podcast. For the topic on HCC TV, I am Dr. Darin Baskin.
When the last bell rings, don't stress about what comes next. At Houston Community College, we make your lessons matter. From healthcare to tech, or business to the arts. Open the door to HCC Real World Education, where passions become careers. Find more at hccs.edu and let your success take flight.
If you need to do something to feel okay to drive, you're not okay to drive. Don't drive buzzed.
When I was your age, I was just like you, fascinated by stars. But now I get to search for life in the universe. And who knows, maybe life is looking for us too.
So we're like aliens to them?
Yeah. Does anyone want to be a scientist now?
I do.
Awesome. We need more girls in STEM.
Maybe we can find aliens.
Your blood pressure numbers could change your life. Talk to your doctor about creating a plan that works better for you. Start taking the right steps at manageyourbp.org.
Now I'm, trying to get better, stronger than ever.